What if I told you that more than 2,000 seniors in their 60s reduced burning leg pain and stiffness in just a few weeks without injections or surgery? You don't believe me? These are real outcomes reported from a Tokyo-based clinical study where targeted movement programs led to a reduction of sciatica-related pain by over 50% in older adults. The real breakthrough is not that relief happened, but that it came from restoring spinal movement instead of chasing pain in the leg. And this matters deeply because according to the National Institute of Neurological Disorders, up to 40% of seniors experience sciatica or nerve-related leg pain, with risk rising after 60. The encouraging news is that Japanese studies show gentle spinal movements can restore nerve space and function, and that's exactly what we will show you today. Welcome back to another episode of the Senior Health Podcast, where East meets West to help you stay strong, steady, and independent. In a few minutes, we are uncovering the 3 movements that directly relieve pressure on the sciatic nerve and help you move with confidence again. And as always, Japan's oldest doctor is guiding us. Doctor, how important is this episode? So important, John, because many seniors are told nerve pain is something they must tolerate or suppress with medication. But the exercises I am about to share show how simple movements can calm the nerve itself and give seniors back years of comfortable movement. And the research speaks for itself, right? The level of change we see due to these exercises is rarely seen with medication alone. It really is remarkable, John. But before we begin, please share with us in the comments your age and where you are watching from, since we love to know more about our audience. That offer really lands because so many seniors feel like they are doing everything right and still living around nerve pain that quietly limits their days. Yes, and I hear that often in my clinic late in the evening when seniors finally admit how much it has changed their confidence. Many believe sciatica lives in the leg because that is where the pain speaks the loudest. But the nerve is only reporting a problem that usually begins much higher and much earlier. That reframing alone feels relieving because it explains why so many stretches never quite solve the problem. Exactly. And this misunderstanding leads seniors to chase relief in the wrong place. They stretch the calf, the hamstring, even the foot, and feel brief comfort. Meanwhile, the true pressure near the spine quietly remains. I see that too. And it explains the frustration I hear when seniors say, "The pain always comes back by morning." Yes, and there is another layer that often gets missed after 60. In younger adults, sciatica is more likely linked to a disc injury that comes and goes. In seniors, it is usually related to gradual narrowing in the spine that builds silently over years. That difference changes everything about how we approach relief. That helps make sense of why walking can feel helpful one day and punishing the next. It also explains why so many seniors blame themselves for losing stamina. The key here is to remove blame from the body. Aging spines adapt differently, and nerve space becomes more sensitive to posture and movement. This does not mean damage is inevitable. It means the strategy must match the biology of this stage of life. I appreciate that compassion because fear often keeps seniors frozen. When pain feels mysterious, it is hard to move with confidence. Of course, and fear tightens the body even more. I have seen seniors limit their steps, shorten their stride, and hold tension without realizing it. That tension further compresses the nerve. Once they understand what is really happening, the body often softens almost immediately. That softening is powerful because it gives seniors back a sense of control. It turns pain from a threat into a signal. Yes. And signals are meant to guide us, not frighten us. Sciatica is the body asking for space and calm in the right places. When seniors learn where that space comes from, relief becomes logical rather than mysterious. That idea of space feels important, especially for listeners who feel boxed in by pain. It makes me wonder how quickly the body can feel that change once the right approach is used, often much faster than seniors expect. Sometimes the first sign is not less pain, but a feeling of ease or warmth. That is the nerve realizing it is no longer being crowded. And when that happens, the body is ready to respond. That pause right there feels meaningful. When the body is ready, it feels like an opening. That's correct. Now, I am curious how you help seniors experience that opening safely at home. When you think about everything you have seen over the years, what is the very first exercise or position you start with to help that relief begin? I usually begin by helping seniors feel relief before asking them to move at all. And the first step is choosing a calm, comfortable place where the body can fully rest. That sense of safety is what allows the spine to soften and the nerve to breathe again. That already sounds different from what most seniors expect when they hear the word exercise. Yes, and that difference matters. I ask seniors to lie on their back and place their lower legs on a chair, couch, or bed, so the knees are gently bent and supported. This position lets the lower spine settle naturally without effort. I can picture that clearly, and it feels doable even on a painful day. Should seniors be adjusting anything else once they are in that position? They should start by noticing the breath and letting the lower back gently flatten without pushing it down. The feet should feel heavy and relaxed, almost as if they are melting into the support beneath them. When done correctly, there is no strain, only a sense of easing. That reminds me of patients who say relief feels subtle at first, not dramatic. They often wonder if something so gentle can really help. That is very common. This position works because it reduces compression at the spinal levels where the sciatic nerve is often irritated after 60. As the pressure eases, blood flow improves and the nerve becomes less reactive. Many seniors notice warmth or a quiet release traveling down the leg within minutes. That warmth description is powerful because it gives seniors something real to listen for. How long do you usually suggest they stay there? I always encourage seniors to remain in the position for 5 to 10 minutes or longer if it feels comforting. There is no rush and no target to hit. This is about letting the spine rest in a way it rarely does during the day. I hear that a lot in seniors who spend hours sitting or standing without true spinal rest. It feels like permission to finally let go. Exactly. And this is why I call it a position rather than an exercise. Seniors can use it once a day or several times during flare-ups without fear. Over time, the body begins to trust that relief is possible. That trust changes how everything else feels. That trust piece really stands out. It feels like the moment where confidence quietly returns. And once confidence returns, the spine becomes ready for something more active. This is also when gentle warmth can help because a simple heat pack over the lower back encourages blood flow and lets the muscles soften even further. That added warmth often makes it easier to invite movement and create more space. But that next step only works if this first sense of relief has truly been felt. That makes me curious about how you build on that feeling without taking it away. So what's the next exercise you usually guide seniors once this position has done its job? Yes, and this is where we begin to gently invite movement without disturbing the calm we just created. The next step is sitting toward the front of a sturdy chair with both feet flat on the floor and set a little wider than the hips. Take a slow breath in, and as you breathe out, gently lean forward from the hips, letting the hands slide down the thighs. Stop as soon as the body feels a stretch or a sense of opening. Then stay there for about 5 seconds. That pacing feels important because it removes the pressure to rush. Yes. And after those 5 seconds, seniors slowly return to sitting upright as they breathe in again, letting the hands slide back up the thighs. That full cycle counts as 1 repetition. I usually suggest starting with 5 repetitions and gradually working up to 10 once or twice a day, depending on how the body responds. That reminds me of seniors who worry they need to push farther each time to make progress. They do not. The key here is ease, not depth. Each repetition simply invites the spine to open a little more. And some days, that opening is small. If the leg pain eases, softens, or shifts upward toward the back, that tells us the nerve is responding well. That kind of feedback feels empowering because the body is giving clear signals instead of confusion. It helps seniors trust what they are feeling. Exactly. And I always remind them to stop immediately if pain sharpens or shoots farther down the leg. This exercise is meant to calm the nerve, not provoke it. When done gently, it often brings relief within minutes. and builds confidence over days. I hear that a lot in seniors who are afraid of setbacks. Knowing when to stop seems just as important as knowing when to move. Yes, and timing matters too. Many seniors benefit from doing this before a walk, during a break, or after sitting for long periods. It resets the spine and keeps nerve space open throughout the day. That rhythm can change how movement feels overall. That rhythm idea really resonates because pain often comes and goes with daily habits. It makes this feel practical, not clinical. And once seniors understand that rhythm, they often ask how to adjust when flexibility is limited or when bending forward feels awkward. That is when we adapt the movement to the body, not the other way around. Those variations can make all the difference. That makes me curious about those adaptations, especially for seniors who feel stiff or unsteady. How do you help them get the same benefit without discomfort? Of course, and this is where we slow everything down even more. For seniors who feel stiff or unsteady, I often shift the movement to the floor or the bed where the body feels fully supported. One gentle option is lying on the back and slowly bringing both knees toward the chest, only as far as feels comfortable. Holding that position for 15 to 20 seconds can create the same opening in the spine without any balance concerns. That feels like such a relief already. I can imagine seniors listening and realizing they do not have to sit or stand to get the benefit. Yes. And another variation I use is for seniors who still want to be on their hands and knees but feel cautious. It's often called the child's pose, and they begin with the hands under the shoulders and knees under the hips. From there, they slowly sit the hips back toward the heels while keeping the head and neck relaxed. This position is held for about 20 seconds and repeated 2 or 3 times. It gently opens the lower back while keeping everything stable and grounded. That sounds like a movement that meets seniors where they are, not where they think they should be. Exactly. And that mindset is essential. I always remind seniors that comfort is the guide, not flexibility or range. These variations allow the spine to open without fear, which is often what the nervous system needs most at this stage. And once that fear softens, something important changes. The body becomes ready, not just to open, but to support itself again. That pause feels meaningful, because support really does sound like the missing piece. When relief has started and the spine feels calmer, what is the next exercise you usually guide seniors into to build stability without letting that tension return? Yes. And once the spine has opened a little, the next step is to help it stay open. That is where gentle core stability matters, especially for seniors who feel like their back gives up as soon as they stand. This third exercise builds support without strain. That makes sense because relief is wonderful, but it is the staying power that changes a senior's whole day. And it also feels less intimidating when you say stability instead of strength. Start by lying on your back with your knees bent and your feet flat on the floor or on the bed. Place your hands lightly on your thighs and take a slow breath in. As you breathe out, gently tighten the lower belly as if you are drawing the belly button slightly downward and let the lower back feel a little flatter against the surface. That cue is helpful because seniors often overdo it and hold their breath. Exactly. And the movement should stay small. After you set that gentle abdominal tension, breathe out again and slowly lift your head and shoulders just a few inches. Keeping the neck relaxed, hold for 1 second at the top, then lower back down as you breathe it in. That feels approachable, like something seniors can do even if their back is sensitive. Yes. And I usually recommend 2 sets of 10 to 15 repetitions, resting about 30 seconds between sets. If the neck feels strained, seniors can place their hands lightly behind the head for support without pulling. And if lifting the shoulders feels too difficult, they can do a smaller version by lifting only the head slightly and focusing on the gentle belly tightening. That reminds me of seniors who are surprised that small movements can change their pain pattern. They often feel proud because they finally found something they can actually stick with. That pride is part of healing. This exercise teaches the body that the spine is supported from within, so it does not have to brace and tighten all day. And once seniors have that support, they often notice they can stand and walk with less guarding. But there is one trap that can undo all of this even when the exercises are perfect. That really grabs me because I see seniors work hard and still get stuck. What is the most common trap or mistakes you see that quietly brings the pain right back? I see a few common mistakes again and again, all coming from good intentions. And the first one is forcing a perfectly upright posture all day, which keeps the lower spine stiff and slowly narrows the space the nerve needs. Another is pushing too hard with walking, believing longer is always better when long uninterrupted walks can quietly irritate the nerve again. And the third is resisting support like a cane, walker, or even a shopping cart, when in reality that support reduces spinal load and gives the nerve a chance to calm down. I hear that a lot in seniors who feel proud of staying active, but frustrated by setbacks. Exactly. And none of these mistakes mean seniors are doing anything wrong. They simply show the body needs a gentler strategy. Now, when posture relaxes, walking is paced and support is used without guilt. Pain often softens and movement feels easier again. That really stays with me. It feels like the moment where effort turns into understanding. How do you help seniors carry that mindset with them after the episode ends? Especially on the hard days. I remind seniors that understanding itself is progress even on difficult days. When pain returns, it is not failure. It is simply the body asking for patience and gentleness again. That really grounds this whole conversation for me. Now, if you are still listening, leave us with a comment where you are watching from. Like the episode and subscribe to the channel. Oh, and watch this next video right now. Yes, please. We've picked this one especially for you.